Today, we are going to talk about something we all do, yet often don't think enough about: sleep. It's a fundamental part of our lives, as essential as the air we breathe or the food we eat. We spend about 1/3 of our existence in this state of rest. However, in our busy modern world, sleep is frequently the first thing we sacrifice. Many people see it as a luxury or even a sign of laziness, pushing their bodies to the limit. But this is a dangerous misunderstanding. Prioritizing our sleep is one of the most important decisions we can make for our overall health and well-being, impacting everything from our mood to our long-term physical health. It is not wasted time. It is a critical investment in ourselves. So what exactly is sleep? In simple terms, sleep is a natural state of rest for the mind and body. During this time, your awareness of the outside world is greatly reduced. It might seem like your body is just shutting down, but that couldn't be further from the truth. Your brain is actually incredibly active while you sleep, performing a wide range of essential tasks. Think of it like a highly efficient maintenance crew that comes in overnight to clean up, make repairs, and prepare everything for the next day. This period of reduced consciousness allows vital biological processes to take place that simply cannot happen as effectively when we are awake and constantly interacting with our environment. The reasons we need sleep are numerous and profound, touching every aspect of our biology. Sleep is crucial for our brains. It helps consolidate memories, moving important information from short-term to long-term storage. This process is why a good night's rest can help you remember what you studied for an exam. Sleep also allows the brain to clear out waste products that build up during waking hours. For our bodies, sleep is a time for physical repair. It supports healthy growth, repairs tissues, and strengthens our immune system, making us better equipped to fight off infections and illnesses. Without adequate sleep, these critical functions are compromised. The amount of sleep a person needs changes significantly throughout their life. It's not a one-size-fits-all prescription. Newborns and infants require the most sleep, often needing between 14 to 17 hours a day for their rapid development. As children grow, their sleep needs gradually decrease. Toddlers typically need 11 to 14 hours, while school-aged children should aim for 9 to 11 hours. Teenagers, whose brains and bodies are still developing, require about 8 to 10 hours per night. For most adults, the magic number is between 7 and 9 hours. And as we enter our senior years, the recommended amount stays around 7 to 8 hours, although sleep patterns may become lighter and more fragmented. When you close your eyes at night, your brain doesn't just switch off. Instead, it embarks on a remarkable journey through different stages of sleep. We cycle through these stages several times each night. The two main types are non-rapid eye movement, or NREM, sleep, and rapid eye movement, or REM sleep. The journey begins with NREM sleep, which is divided into 3 parts. The first stage is a very light sleep, where you can be easily awakened. In the second stage, your heart rate and body temperature drop as you drift into a deeper state of rest. The third stage is the deepest kind of sleep, where physical restoration and growth hormone release occur. It's very difficult to wake someone from this stage. After moving through the NREM stages, you enter REM sleep. This is the stage most associated with vivid dreaming. Your eyes move rapidly back and forth behind your closed eyelids, which is how this stage gets its name. During REM sleep, your brain activity looks surprisingly similar to when you're awake. Your breathing becomes faster and irregular, and your heart rate and blood pressure increase. However, your major muscles become temporarily paralyzed, which is a protective measure to prevent you from acting out your dreams. This stage is vital for emotional regulation, memory consolidation, and learning. Each full cycle of NREM and REM sleep typically lasts about 90 minutes. Unfortunately, for millions of people, this nightly journey is disrupted. A sleep disorder is a condition that regularly prevents you from getting restful sleep, leading to daytime sleepiness and other health problems. These are not just occasional bad nights. They are persistent issues that interfere with normal physical, mental, and emotional functioning. There are many different types of sleep disorders. Some of the most common ones include insomnia, which is the chronic difficulty in falling or staying asleep. Another is sleep apnea, a serious condition where breathing repeatedly stops and starts during sleep. Restless leg syndrome and narcolepsy are other well-known examples. Recognizing you might have a problem is the first step, but how do doctors confirm it? To measure sleep quality and duration, physicians have several tools. The most comprehensive test is called a polysomnography, or a sleep study. For this test, you typically spend a night in a sleep lab. While you sleep, sensors attached to your body monitor your brain waves, heart rate, breathing patterns, eye movements, and muscle activity. This provides a detailed picture of what's happening during your sleep cycles. For some conditions, doctors might use a home sleep apnea test, which is a simpler device you can use in your own bed to monitor your breathing. A sleep diary can also be a very useful tool. When a sleep disorder is diagnosed, there is good news. Many effective treatments are available. The right treatment depends entirely on the specific disorder. For sleep apnea, a common and effective therapy is the use of a continuous positive airway pressure, or CPAP machine. This device delivers a steady stream of air through a mask to keep your airways open while you sleep. For insomnia, a powerful non-medical treatment is cognitive behavioral therapy for insomnia, or CBTI. This therapy helps you identify and change negative thoughts and behaviors that are preventing you from sleeping well. Other treatments might include dental appliances for snoring or specific medications for conditions like restless leg syndrome. Beyond professional medical treatments, there are many simple tips and habits you can adopt to improve your sleep. This is often referred to as practicing good sleep hygiene. One of the most important tips is to maintain a consistent sleep schedule. Try to go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's internal clock. It is also important to create a restful environment. Your bedroom should be dark, quiet, and cool. Avoid using electronic devices like phones or tablets in bed, as the blue light they emit can interfere with your body's production of melatonin, the sleep-inducing hormone. Another key piece of advice is to pay attention to what you eat and drink before bed. Avoid large meals, caffeine, and alcohol in the hours leading up to your bedtime. Caffeine is a stimulant that can keep you awake, while alcohol, though it might make you feel drowsy at first, can disrupt sleep later in the night. Instead, you could try a light snack or a warm, caffeine-free beverage like herbal tea. Regular physical activity during the day can also promote better sleep at night. Just try to avoid vigorous exercise too close to bedtime, as it can have the opposite effect and make it harder to fall asleep. Finally, establishing a relaxing pre-sleep routine can signal to your body that it's time to wind down. This could be anything that you find calming. You might try taking a warm bath, listening to soft music, reading a book, or practicing gentle stretching or meditation. The goal is to create a buffer zone between your busy day and your time for sleep. This routine helps you transition from an active state to a restful one, making it easier to fall asleep and stay asleep throughout the night. By consistently following these simple tips, you can significantly improve the quality of your rest and your overall health. Sometimes, lifestyle changes and therapy are not enough, and sleep medications may be considered. These medications, often called hypnotics or sleeping pills, can be helpful for short-term relief from sleep problems. They work in different ways depending on the type of drug. Most commonly, they work by targeting specific receptors in the brain to slow down brain activity, which helps induce a state of drowsiness and sleep. Some are designed to help you fall asleep, while others are formulated to help you stay asleep through the night. It is important to remember that these are powerful drugs with potential side effects. Because of these potential side effects and the risk of dependency, sleep medications should always be used under the guidance of a doctor. They are typically recommended for short-term use, such as during a period of acute stress or while you are working on behavioral changes through therapy, like CBTI. A doctor can help you choose the right medication, determine the correct dosage, and monitor you for any adverse effects. They are not a permanent solution for chronic insomnia, but can serve as a useful tool to help break a cycle of poor sleep and get you back on track while you address the root causes of your sleep problems. In conclusion, sleep is not a passive activity, but a dynamic and essential biological process. It is the foundation upon which our physical health, mental clarity, and emotional stability are built. From repairing our bodies to consolidating our memories, the work that happens during those quiet hours is absolutely critical for our ability to function at our best during the day. Understanding our own sleep needs, recognizing the signs of a potential problem, and practicing healthy sleep habits are some of the most powerful steps we can take to protect our well-being. It is a daily practice of self-care. Therefore, I encourage you to view sleep not as an inconvenience or a luxury, but as a non-negotiable pillar of a healthy life. By giving your body the rest it needs, you are making a direct investment in your long-term health and happiness. If you struggle with sleep, please do not hesitate to speak with your doctor. There are effective solutions available that can help you reclaim your nights and, in doing so, transform your days. A good day truly starts the night before. Sweet dreams and be well.